Joining me now from here in Washington is Gavin MacGregor-Skinner. He's director of the Global Biorisk Advisory Council. Gavin, you have advised governments when it comes to infectious diseases, and back in February, you told us about the importance of information sharing with the public. So what is your take on these reports? As we heard in Jim's report that here in the U.S. that COVID hospital data will now be rerouted to HHS and the White House.
Well, again, we'll have to wait and see, but we've really struggled over the last few months of actually using the hospital data that's been available in the National Healthcare Safety Network. This is the CDC database we're talking about. It's trusted, it's old, but it's also outdated. It's not the best that we could do when it comes to managing this critical data from these individual hospitals throughout the country. And let's be really clear on this. This data goes to county departments, state departments, the mayor's office, as well as the federal government. So it goes to lots of different levels where it's used and used effectively. If it goes to a centralized system now, which is what we're hearing through the Department of Health and Human Services, we need to ensure that that data is still transparent, but also it's up to date and it's able to be in a format that can be used to make critical decisions.
So what are your observations then about the cases that we are seeing explode all over the United States and the trends that you're seeing compared to what you're looking at in other parts of the world?
Well, we're getting much better here in the US. We're getting much better in really scrutinizing and focusing down at the community or neighborhood level. There are some communities and neighborhoods in the US that are doing a great job. They've had no cases of COVID-19 or very few cases. There are others that we call hotspots. And you'll see again the data that gets released that I look at every day. Oh, this zip code is a hotspot. This community, this neighborhood is a hotspot. And there are real reasons for that, whether it be poverty, it be other socio-demographic problems, other issues that we aren't addressing, access to care, for example. But it's really important that we actually focus in more locally of where this virus is transmitting and not just think it's everywhere, because it's not. It's really focused down at the local neighborhood community level.
So we're 6 months, 7 months into this. If you had to advise the U.S. government, what would you say? Where do you start at this point? I mean, this has been around for a while.
It is. And again, we're still sitting here in the middle of July now going, gosh, gee whiz, I wish we'd done better back in February. And the point was the messages weren't consistent. The messaging was confusing. The messaging that was coming out at that stage was, don't worry about it. It just affects old people, and 80% of you will get infected and you'll feel nothing. Well, we know that was wrong. But we also saw that was wrong when we saw the data coming from Singapore, the data coming from Italy and Spain and other countries, and including China, that it was affecting a greater range of people, different ages, male and female. And so the point was that our messaging to the community here in the US was confusing. It still is confusing. Why is it in July now, after so many months, we're still debating whether you put on the mask or you don't wear the mask? It's wrong. We've got to go back and look at what are those communities doing different that's successful, putting on a mask, washing their hands, cleaning and disinfecting high-touch surfaces, and maintaining physical distance, and ensure that we can replicate that and make it consistent.
So we have about a minute left. The big debate right now, of course, is do kids go back to school in the fall? And there's a large divide between parents and what the teachers are saying and what governments are trying to determine. So what would you say here is the answer?
Education's critical. But the education of our youth has to be done in a way that's different than what we did in 2019. We have to stagger our start times. We have to ensure that the kids and the teachers take on their own responsibility of wearing a face covering, washing their hands with soap and water regularly. Teach every kid in the country how to wash their hands properly. This is what we didn't do back in February. Now, I totally support that schools need to open, but they need to do it in a way that it's staggered so we don't get crowding, because it's that crowding that transmits this virus. But we need to do it, and we need to do it in a way that it's safe, but also ensure that kids get good education.